Welcome to this edition of Buncombe Life. We're here at Fullerton Genetics. I didn't know it was here. I'll be honest with you, I didn't know they did anything with genetics, so we're here to find out what it is that they do. So come with us. You can learn a lot right along with me. I'm here with Dr. Jack Tarleton, Fullerton Genetics Lab Director, correct?
Correct.
Okay. Now, what I've learned since we came in is that genetics testing has been here in Buncombe County for 20 years. Really? I had no idea.
Well, the program started in 1993-94 and was located in a different part of the Mission campus at that time. And Dr. Ellen Boyd, who had been a pediatrician here in town for a number of years, had decided that she wanted to do something besides pediatrics, and came to the Greenwood Genetics Center in South Carolina, where I was training at the time. And we teamed up, and she came back a couple of years before I came, and I came in 1996. And we started the
You've
program.
Been here since '96.
Yes.
So you've been here almost from the beginning.
Yes.
Oh, that's great. What kind of genetics testing happens here?
The original laboratory setup was for chromosome testing only, and about that time molecular genetics became a mature discipline, and we added that component to the lab. So
what is chromosome? I'm going to do molecular in a minute. These are big words for me now. Chromosome testing, what was that for?
Typically for children with birth defects that are chromosomal in nature.
Like Down
syndrome would be a prime example of that. There are a number of those. Chromosomes there typically are 46 of them, and if you have an extra 21st chromosome, you have Down syndrome. And there are a number of different recognizable syndromes along that.
Okay, so you would test for people to that here?
Yes. And chromosomes are big packages of genes, but they actually can break and rearrange, and so we actually study children that have birth defects that may have the normal chromosome number, but they've been rearranged in some fashion or form.
So different kind of birth defects can be tracked to your...
Correct.
Oh, that's just fascinating.
So that started in the mid-90s, and it still continues today.
Okay. Now what's the molecular? Molecular
genetics really is kind of a general term meaning a single gene. So I mentioned that chromosomes were packages of genes. So you're familiar with the double helix, the DNA double helix. So if you unwind the double helix and think of it like a ladder, it has cross rungs like a ladder or steps. So a chromosome would be millions of those steps strung together
in
one organelle, if you would call it that.
Oh my gosh.
And a gene may be is a code that's embedded in that chromosome, and an average gene, they come in different sizes, but they may be 50,000 of those. And there's a specific code there that gets interpreted in the cell.
Oh my God.
And proteins get made, and proteins really are what do things in the cell.
And these are tiny, this is tiny work.
Yes.
Tiny little things.
Very tiny. But they're recognizable because we have procedures for testing them. So we can tell of the 46, they come in different shapes and sizes, and so we can actually do our studies based on that.
Well, now, I understand kind of the chromosome testing, but when you went to molecular testing, what does that tell you more about those individual chromosomes and how problems can arise from?
Yes, and you've heard many of the recognizable inherited disorders are single gene disorders. So muscular dystrophy, cystic fibrosis are common ones. There's about 5,000 recognized clinical entities that are single gene entities. Many of them are really rare. Some of them are more common. Cystic fibrosis, sickle cell anemia are common. And each of those have changes in the gene code that cause the disorder. So we're actually focusing on that single gene to fish out that mutation, to find that mutation.
What is going on with individual people.
That's right.
Here.
Yes.
So do people send just Mission? Do you just work with Mission, or do y'all work with people from all over?
The vast amount of our testing is internal to mission or in local physician offices that get referred to us. But about 10%, 15% of the testing we do can come from anywhere in the world. We have a couple of areas of expertise, gene-wise, that we are recognized for, and people send us specimens, typically blood specimens or DNA that's been isolated from a patient, for us to test and report back to them what we're finding.
So that's when somebody comes here with a problem, and then y'all are really the investigators to
Very
find
much
out
so,
what
yeah.
that is.
It is. It's funny you say that because it really feels that way, is that we're on a treasure hunt of sorts, looking for this clue one way or the other of what's going on.
Yeah, it's fascinating. I mean, it's kind of mind-boggling too.
What makes coming to work interesting every day.
Yeah,
So
and rewarding, I bet, if you can find.
It is, I can't describe the elation I feel. And you know, this is not good news sometimes for a patient, but the clarity of a diagnosis, whether we have a treatment or not, still has a lot of value. And when I find something, I'm really overjoyed in a sense. And I know that the next step is conveying that kind of complex information to a patient and making it understandable.
Right. That what you have found, so that then their physician can help them.
Yes, and that's why we really work as a team. So my job, or the physician's job, is to say, well, I think you ought to look at this gene or that gene.
Right.
We go and do that with our laboratory testing. We have a result that then has to be explained in a fashion that people can understand.
Yes.
And do something with it. And sometimes there are treatments that can be done.
Right, just from what you found here.
Yeah.
That's amazing. Now, what happens if a patient were to need testing that you don't do here?
We're really networked. It's a pretty small community worldwide with all the geneticists in the world. We really could gather them in an auditorium in some cases. There's probably a few thousand of them.
Well, we're very lucky to have this here then.
Yeah, it's unusual in a non-academic hospital setting, not a medical school, to have this sort of operation. There are just a few in the United States. But we're networked worldwide, so I mentioned that a lot of these disorders are rare. There may be 1 in a million type of incidents, and no one laboratory can do all of the testing, so we have to network. Even the largest laboratories in the largest medical settings still do the same thing, they refer them. And I mentioned to you that we have expertise in a few genes that we are recognized for, and we're part of that network.
Yeah, that is so exciting. Again, just another reason I'm so glad to live here.
It is a great community.
It is. Now, is there anything as we finish up here that you would want folks to know about the clinic?
Just that the services that you may need are in many cases readily available. We, as I mentioned, operate as a team, so it's not just 1 or 2 individuals. We've got 30 some odd folks on our staff, many of whom are involved in the information conveyal part of the process. So the resources are here locally that can actually take care of most situations. If it's something that we don't have expertise, we can find somebody that does.
Find somebody that does. That is so encouraging. Thank you for
You're
spending
quite
time
welcome.
with us.
Thank you. Thanks for coming by, and we appreciate the opportunity.
Do too. I'm here with Dr. Lynn Dressler, who is the Director of Personalized Medicine. You have no clue what that is, I bet, because I didn't until we came for this interview. And I want you, thank you so much for talking to me today.
Thank you for having me.
I want you to start with something you told me just a few minutes ago, which cleared all the fog for me. I had no idea we even had a genetics anything here, because I guess I've been fortunate to never need genetics counseling or genetics anything. And I know a lot of folks at home are the same way, they just don't know. But this is an amazing resource, and you kind of cleared it up for me. You said we do so much here that's so complicated, and we've been doing it here for 20 years. Your piece is the new piece, but will you tell me what the 3 pieces are?
Sure. In the Fullerton Genetics program, there are 3 different components. One is the clinical component. talking about clinical genetics, where physicians and genetic counselors will talk with patients and families to help understand their risk, to help understand a disease that they might be susceptible to develop. Then the second component is the laboratory, which is the place where the testing gets done. It's very sophisticated laboratory equipment, and these are expert people that get national and international recognition.
Right. Right here.
Right here. And those two components have been here for 20 years, tucked away in Western North Carolina.
Right.
And it's because of those two components and the vision of the leadership and other support that we have here at Mission that I was able to come here to try to start a new program in an area called personalized medicine.
So that begs the question, what is personalized medicine?
Well, this third component of the Fullerton Genetics Center, which we call personalized medicine, can mean a lot of things to different people. But our focus right now is to look at how your genetics can help you and your doctor select the best therapy for you to manage your condition.
Okay, so let's say, first of all, what really is genetics? That's just how I'm made up.
Yeah, genetics is a component of why you are who you are.
Okay.
So it's just a component of it.
Yeah. One of the things that made us investigate and really started this conversation about genetics was back, I think probably a couple years ago now, Angelina Jolie and her BRCA gene, and the really radical things that she did when she found out that she was predisposed for breast cancer. Is that kind of how does that play into all this?
That is part of what we do here. The clinical genetics program and the laboratory have been looking at characteristics that people may inherit and develop disease. Right. So the BRCA1 and 2 genes that Angelina Jolie was talking about that she had meant that she had mutations that would make her more susceptible to develop breast cancer.
Right.
So the clinical part of the program and the laboratory part of the program actually work with patients to identify if they're appropriate for testing, and if they are, then to have the testing done and then to talk to the patients about what the testing results mean.
Right.
When we talk about genetics, people usually think about their risk of developing disease or prenatal or postnatal testing. Well, we now have the power, the knowledge, the technology, the laboratory expertise to look at genetics in a way not only to look at your response or your risk of developing disease, but now we can branch out to other areas, such as looking at your genetics to help understand how you'll respond to a drug, whether you'll have a bad side effect or whether the drug will actually be effective based on your genetic makeup.
Right. Now, is that part of the personalized medicine piece?
Yes.
So if, let's say that I'm been told I have either a disease or cancer of some kind, and to help me get better, that's what you do, is say, these medicines, let's look at you and see, do these medicines, are these going to work?
Exactly.
Wow.
So,
I had no idea. I thought there was just, okay, there's 3 drugs for this, here you go, let's see if they work. If they don't, oh well.
yeah, I mean, I think everyone has experienced some side effect to a drug that they've taken. So the idea behind personalized medicine is to use genetics to try to distinguish those people who will have a bad side effect, or those people for whom the drug may not work before we get the drug.
Right. Because it's complicated enough to get the diagnosis that something terrible is going on. This just helps you know that that treatment is going to be more personalized.
I want to be able to provide the service here through personalized medicine so that a patient like me may have the option to do some testing before they get the drug so that we can minimize the time it takes to get an effective drug.
Now, is this treatment, because this is the first I've heard of it, but I've never needed anything like this. Is it available for anyone? I understand how they would get here to help with genetics through cancer, but are there other ways people would come and...
Sure. In the non-cancer arena, we are just starting to learn about associations between how someone's inherited DNA may put them at risk for having a bad side effect in non-cancer conditions, or whether or not the drug will actually work for them. So there's about 2,000 FDA-approved drugs, a lot of drugs.
Yeah.
About 160 of those have information about how your genetics may predict your response to that treatment. About 23 of those drugs have clinical guidelines associated with them saying that if you have this certain variation, this is what you might want to do with that information.
So in those situations, this is where they come for testing.
Right. There are situations, so right now they're in cardiology, infectious disease, anti-seizure medication, and HIV therapy. Those are the 4 areas for which, before you take this drug, it'd be a good idea to get this test.
Right.
So Mission Health has a mission statement of getting a person to their desired outcome. So in the case of personalized medicine, that might be finding a drug that's really going to work for my condition with the least harm, with minimal waste. And then the final thing is getting, having that patient have an exceptional experience.
Exactly.
And I think that's where these components, these 3 components of Fullerton Genetics, plus our pathology, our pharmacy, our clinical care, our health information technology, comes together to have a smooth, streamlined, coordinated process with expert individuals to enhance the care that's already being given.
Right. And I think that's a great place to end, because that is the overall goal of everybody I know watching. Is there anything else that you want to leave us with as we end?
Well, I think that one of the questions that I always get is, will my health insurance company cover this?
That's right.
And it's a great question because it is, unfortunately, a large part of decision making in healthcare these days. Medicare does cover the tests for those drugs. Many other insurance companies also cover those tests and beyond. Some of them extend beyond that list. And in cancer, it's very common for insurance companies, health insurance companies, to cover these tests because in cancer they're standard of care.
Right.
And so they will cover that. I think as time goes on, as health insurance companies are seeing that this testing might actually translate into real cost savings and higher quality of care, so that they're willing to cover more of these tests.
Right, less waste and cost savings.
Yeah.
Yeah. Well, I think it's exciting. I think it's wonderful. Thank you.
It was great. Appreciate it.
I'm here in this nice, cute little exam room with William Allen, who is a clinical geneticist here at Fullerton. And I'm going to have to start from the beginning and ask you, what is a clinical geneticist?
So clinical geneticists are individuals who typically have finished a residency in some discipline, such as medicine or pediatrics or family practice, and then they've gone on to further training to learn specifically about genetics and genetic conditions, testing for those conditions, interventions, and treatment for individuals with those genetic conditions.
Right. So I think the first question I want to know is, how would I get to see you? How would I be referred here by a doctor, or just give me an example of somebody that would...
Most of the patients that we see are referred. So they have their physician who says, well, you have this condition, and this is a genetic condition, and I don't understand it as well as I would want to, or we need to get you to see the genetics doctors to actually confirm my suspicions, and so you need to have genetic testing
Right.
to look at that. Or, I don't know what's going on, maybe the genetics people can help us figure that out.
Oh, now, what's an example of something where they didn't know what was going on? Just
Well,
an example.
so for instance, if an individual has, say, autism, and so we know that most individuals who have autism
Right.
do not have a cause that right now we can identify. But about 15 or 20% of the time, there may be an underlying condition that is causing that finding of autism. And so our job is to identify that number of individuals who do have an identifiable cause, because again, that can be important as far as intervention, as far as recurrence risk for those individuals and families.
Yeah, and we've talked to the folks in the clinic, so that's how they come here and see you, and then the clinic or the lab
That's right.
is the ones that do the investigation work to narrow it down
Exactly.
and the tests. And then the third part, it seems like the personalized care. Then they would kind of walk them through what y'all have found, what the lab has found, and then what you work with them.
Now, when you say they, who do you mean they would walk them through?
The personalized care, people here.
So that's
at
exactly
Fullerton.
right. So
Yes.
then we're very much involved with, okay, we've made this diagnosis.
Right.
Now what do we do with this information?
Right.
And what resources are available in the community? What are the health concerns that are associated with this? How can we prevent those? And sometimes, what are the treatments?
Right.
As far as
And
how can we fix this?
that's great, because people don't know. You may say, okay, you have, now we've figured it out. This is what you have. You can't drop me. I don't know. I don't know what to do.
Right,
This is what I've got.
exactly.
How do I,
Yeah.
what's the
So
treatment?
we're working
How
with
do
those
you,
families and their physicians,
Yeah.
and a lot of that is education, and so that's a
Right.
big part of what we do.
yeah, that's huge. And you've been here for 20 years, which I'm so surprised to learn, but so glad to be, again, a resident of Buncombe County. You've got this great resource right here in our backyard.
Mission Hospital was very forward-looking as far as helping to establish a genetics center, and that was Dr. Ellen Boyd, who came here 20 years ago
Right.
and had done her fellowship in genetics. And the hospital got on board with that, and the legislative delegation from this area helped with that, and so that was very forward-thinking,
Yeah.
because genetics has made huge strides over the last 20
and
years.
will continue to, it sounds
Exactly.
like. Yeah.
Yep.
So we know that kids come here. Do you see
Right.
all age groups?
Well, that's a really good question. When I first started in genetics, and I am a pediatrician, and in the past, most individuals have had pediatric training, because most of the people that we have seen have been children.
Yeah, makes sense.
Individuals who might have Down syndrome or metabolic disorders that were identified on the newborn screen or in the newborn period, intellectual disabilities, autism. But as time has gone on and genetics has advanced as far as our ability to understand which genes are associated with certain conditions, we're now seeing a lot more patients who are adults. And so there again, we still see more children overall, but our area of growth
Right.
is in the area of cancer genetics, cardiovascular conditions such as arrhythmias, and then neurologic conditions such as seizures and adult onset neurodegenerative disorders.
Right. Yeah, that's a big growing field right
Right.
there. Another scary thing for sure. So what do you see in the future? Is to grow that piece of it where more you see a more wide range of people for different reasons?
Right. I think that our ability to diagnose conditions is only going to increase
Right.
as the technology advances. But it's still important to know that for most conditions, we don't have a genetic diagnosis
Right.
as far as a gene that is associated with this condition. And so that's going to be the next 100 years as far as really that complex. But for a growing number of conditions, we are certainly understanding the underlying genetic causes for that. And then, of course, that, which is what we hope and we're seeing, is that opens the window for interventions as far as
Right.
treatments.
Right.
And then the other side of that is that we're very much involved in trying to prevent things from happening in the first place.
Right. And
So-
that's the beauty of it right there. Is you can get it, stop it from happening in the
Right.
first place,
Yep.
or be prepared for it.
So for
That would
some
be great.
birth defects, such as neural tube defects,
Right.
if a mother takes folic acid prior to conception, the rate for neural tube defects significantly decreases. And there again, that's a very easy and economical intervention that we don't really even understand the genetics of that. Why does that work?
True.
We just know it works.
It works.
That's exactly right.
That's right. Well, and the not drinking alcohol while you're pregnant.
Absolutely. Another huge area of prevention that we know that alcohol is a really bad actor as far as the developing fetus, as far as brain development and development of other organ systems. And so there again, to not drink alcohol during pregnancy is a huge deal as far as the health of that growing infant.
Right, and preventing you from having to see that infant to determine what could be going on there.
Exactly.
Exactly. Is there anything as we wrap up that you feel like that folks really need to know about genetics and Fullerton and what's in their backyard right here?
Well, I think that it's important to know that genetics is not the answer for everything, that it's still important to exercise and to not smoke and to have a healthy lifestyle. And certainly our genetics is a big component of our health, but we have a very significant impact on our genetics as far as just those healthy lifestyle choices. But I think that genetics does offer the opportunity to understand those medical conditions that may allow us the opportunity to intervene that we don't have the opportunity right now.
Right, and I know that's one thing that I've learned from our time here is it's great to know that you're here. If we need you, you're here. To know that genetics, the education and what you're learning and what going forward, that it's here right in our backyard.
We're very pleased to be here, and we really appreciate the opportunity to have the resources of the hospital and the community to do our work.
Thank you.
Thank you.
I hope you've enjoyed our visit here to Fullerton Genetics, a wonderful resource right here in your backyard. It's kind of a hit or miss, pro or con kind of thing. If you ever have to come here, it's good to know it's here, but maybe you won't ever have to. And that's what they say. Eat healthy, get out there, exercise, and you may never have to visit here, but if you do, it's wonderful to know this resource is in your backyard. Stay tuned next month for Buncombe Life.